Everybody, I hope you're all doing amazing and enjoying this beautiful day. So today we are going to talk about inflammatory bowel disease with amazing Harmony, and she is Ayurvedic practitioner. Okay, so let me introduce myself. Harmony is here. I'm just going to she hasn't sent it yet. All right, so let me introduce myself. I have been practicing women's health movement coaching for 15 years, and I am nutrition counselor and as well as founder of this platform. So I'm going to So while I'm waiting for Harmony to join, I would like to read her bio. Dr. Harmony. Oh, here she is. Welcome, Harmony. How are you?
I'm good. How are you?
Yeah, good. Thank you. Thank you for your time. It's so I was just reading your bio. So Dr. Harmony is a leading Ayurveda and women's health practitioner, doctor of Chinese medicine, acupuncture, the TCM. TCM is the
Traditional Chinese medicine is what
okay,
that's.
yeah,
Yeah.
okay, and registered nurse. With over 2 decades of experience, Harmony blends the wisdom of Ayurveda, traditional Chinese medicine, and Western science to help women reclaim their health, balance their hormones, and step into holistic success. She is the founder and lead educator at the Ayurveda Alchemist Academy, where she trains her health and wellness professionals in evidence-based Ayurveda through certifications in Ayurveda Holistic Health Coaching, Vedic, or how do you say?
Yeah,
Vedic.
Vedic. Yeah.
Vedic. Because back home we say Vedic, and here
Yeah.
Vedic, okay, breathwork and Ayurvedic body therapies. So thank you, Harmony, for this beautiful bio and the amazing work you do, and of course your time for you today. And before we starting this conversation, I just wanted to let people know that this session is all about awareness and educational purposes only, not intended a specific advice for anybody. And if you have an issue or some sort of inflammatory bowel disease problems, please go and see your healthcare practitioner. Or you can directly connect with Harmony, right? So, okay. Hello, everybody. Welcome. Thank you for being here. Today we have beautiful Harmony here. So we are just about to start our question. So, would you like to say anything before we start?
Um, Thank you for having me. I think the bio covered most of it. Ayurveda women's health practitioner, doctor of Chinese medicine, registered nurse. So I combine all of the modalities to
Mhm.
support my clients with hormones, gut health, all the things.
Yes. And you're doing the teachings as well now, right?
Yeah, run an academy as well.
Yeah.
Yes, an Ayurveda
Awesome.
academy.
Yeah, awesome. Okay, let's dive into the questions right away. So,
Yeah.
and if anyone has any question, please put it in the comment section so Harmony can respond to you. And and you can do it at the end as well, or if you have any, just put it in the comment section. So we will start with a question from an Ayurvedic perspective. What are some common root causes or imbalances that may contribute to inflammatory bowel disease in women?
Yeah, so I think it's important to note that inflammatory bowel disease, it obviously involves inflammation in the gut
Mm-hmm.
and immunity, so an immune issue as well. It's often seen as an autoimmune condition.
Yeah.
So from an Ayurvedic perspective, we take all of that into account and then we
Yes.
work out the individual constitution of the person who has
Mm-hmm.
the IBD,
Yeah.
and that will help us direct our management of IDB. So, oh, sorry, IBD. So,
IBD. I was like,
yes, IDB, IBD. It's too many letters. No. With
yeah.
yeah. So there's irritable bowel syndrome, which is just like the functions of the bowels. Like we can get
Mm-hmm.
bloating, and it's sort of
Mm-hmm.
like a blanket term for sort of like more sort of an undiagnosed disorder. It's just very general. Whereas inflammatory bowel disease, there is inflammation and immune aspects of the disease in the bowel. And there's no cure per se, but you can
Mm-hmm.
have really good management of this condition, which can put you into remission for a really, really long time. And that's what we're trying to do, prevent any sort of activity or prevent any flare-ups, which I should say, of this
Yes.
condition, because your immune condition is really sensitive and responsive in the
Mm-hmm.
bowel. So, from an Ayurvedic perspective, we look at an individual's constitution, and that is your individual dosha. So, whether it's Vata, Pitta, or Kapha. And then
Mm-hmm.
we look at the signs and symptoms you're getting with that inflammation or because everyone's signs and symptoms can be somewhat little bit different. And then we look at the dosha's involvement in that. So,
Mm-hmm.
for example, if someone's got a lot of inflammation going on, we're seeing a dysregulation or
Yes.
an activation of the pitta dosha. So we're seeing
Mm.
heat, we're seeing inflammation. With
Yeah.
the vata dosha involvement, we're seeing a lot of central nervous system disruption, and
Mm-hmm.
that can dysregulate the bowel.
Mm-hmm.
And so when we're looking at being really triggered by stress, we know that we
Mm.
have to calm the vata dosha, the central nervous
Mm-hmm.
system.
Yeah.
And we might think like, well, what has stress got to do with inflammatory bowel disease? Like,
Mm.
and when we talk about inflammatory bowel disease, we're often talking about Crohn's disease,
Yes.
ulcerative colitis, those type of things. So yes, they're very physical, and there's inflammatory function in the bowel. So what does stress have to do about it? And often doctors will tell the patients, be mindful of stress. Stress can trigger it, and then the patients will go away saying, "Oh, I basically got told it's all in my head." And that's not really what they're saying, because what they're not
Mm.
explaining is there's actual physiological functions that happen when you are in the mode of stress. And
Yes.
so the way that
Mm.
it impacts the bowel is that it increases inflammatory chemicals in the body. So stress can increase
Mm.
the inflammatory response. It can disrupt the gut brain axis, which is really
Mm.
important, which can also disrupt the microbiome in the gut.
Mm.
And it can increase pain and sensitivity, the
Mm.
stress hormones, and our stress hormones can impact our whole endocrine system and
Yes.
drive higher immune function, right? And so, from
Mm.
an Ayurvedic perspective, we're taking all of this into consideration, including your individual constitution. And then this very important aspect of digestion and gut health we call Agni. And Agni is your
Mm.
digestive fire. And we say if your
Mm.
Agni is really functioning properly and it's being able to metabolize and digest all of the foods. It's being able to metabolize and digest all of your immune functions, all of your thoughts, perceptions, then your body and mind's healthy. But if your Agni is not functioning properly, then
Mm.
it can lead to what we call ama, which is undigested toxins. And that could be from eating foods that aren't conducive to your constitution. So we have physical
Mm.
undigested toxins from the food. And we
Yeah.
also know with the inflammatory disease, we've got not as great gut integrity, or it could be the armor is sort of the undigested and processed stress. So we look at it
Mm.
very holistically. And so,
Yeah.
as an Ayurvedic practitioner, we want to then understand the person's lifestyle choices,
Mm.
their dietary choices, if they're on any supplements or medications, and how they're managing their stress. These are
Mm.
huge things that we want to look at, so then we can start to implement different routines and lifestyle, different dietary
Yes.
choices that's going to be supportive for them,
Mm.
stress management, and also herbal medicine if it coincides and goes with if they're on any other sort of pharmaceutical medication as well.
Yeah. So I am really grateful that you explained how the stress can impact our bowel and they disrupt the brain and gut the connection. And
Yeah.
because most of the time, I think we are not explained that. And that's why we don't understand, like you said, it's all in our head, right?
Mm.
So that is the misunderstanding. But thank you so much. And that makes it so much clearer. And do you mind if you, like, very briefly explain the three doshas?
Yeah, absolutely. So we all living things, including
Yes.
us humans, are made up of the three doshas. We
Mm-hmm.
have all three doshas within us.
Mm,
And the doshas are made up of the elements. So if we're thinking about Eastern medicine, we're looking at
yes.
the different elements. So ether, which is space, and air
Mm-hmm.
makes up the vata dosha. And
Mm-hmm.
then fire and water makes up the pitta dosha, and
Mm-hmm.
water and earth makes up the kapha dosha. So we each have a unique blend of all three
Mm,
of these doshas.
yes.
It sounds like this sort of woo-woo logic, but it
Mm.
actually is a way to explain the functionings of our mind and body.
The
So
types of people that we have, the body is made. Is that what you're trying to say?
yeah, so for instance, the Vata dosha made up of the ether and air elements, if we
Mm,
think about within the body, it's anywhere that the air spaces is. So the air in our lungs, it's any
mm,
sort of hollow organs where there's space. If we get really gassy and bloated, we know that Vata dosha is increased because there's increased gas, there's increased air in our belly. Whereas if
mm,
it's heavy, sticky, sort of hard bloating, it's sort of more of that earthy quality, that kapha dosha. If there's
yes.
inflammation in their body, heat in the body, that's increased pitta dosha, right?
Mm,
We can even look at these doshas and our personality types. So a Vata person, they're like me, they talk with their hands a lot, lots of
mm,
movement like the air. They can be very social, but they can also like be very depleted very quickly. So if
mm,
someone is a Vata dosha and they have IBD,
mm,
then they're going to feel the effects in their central nervous system, and their body's going to feel very weak when they're having the triggers of the
mm,
inflammatory disease. A pitta person with this inflammatory bowel disease, they will start to feel really irritable, a lot of heat, a lot of inflammation, like a lot of that fire energy. And
yeah.
someone who has kapha, more of a kapha constitution, and they have irritable bowel syndromes, they might get the symptoms of feeling really sluggish, really heavy digestive issues, poor, slow digestion, mucus in the stools. So
Mm,
the way we look at the signs and symptoms, we marry it up with the constitution of the person, and that's how we
mm,
can better prescribe different lifestyle prescriptions and different somatic prescriptions and
yeah.
herbal and diet and so on.
Mm. So how can Ayurvedic practices such as nutrition, I think nutrition, lifestyle, and stress management support women living with IBD alongside conventional I think you already covered that. And what are the specific signs and symptoms women should pay attention to that may indicate the gut inflammation and digestive imbalance and early on?
Yeah, okay. So I'll go with the signs and symptoms that we women can experience, and
Mm,
that's when you want to get them checked out for sure.
yes.
Um, a lot of persistent bloating or abdominal pain, like if
Mm,
it's persistent and you get that quite a bit, go to your GP, get it checked out. You might need a scan. You might need to be even ruled out for sort of gynecological things. So we don't
mm,
always
oh,
just assume it's abdominal,
mm,
but you need to get that checked out. If there's any changes in bowel habits. So if that you're fluctuating between diarrhea and constipation, or you're chronically constipated or have chronic diarrhea, that certainly needs to be checked out. If you've got mucus in the stools, that's
mm,
another one. Urgent bowel movements, excessive gas,
mm,
unexplained fatigue and really low energy, because a lot of the
yes.
time with inflammatory bowel disease or SIBO, which is small intestine bacteria overgrowth, these type of gut disorders, we're not actually absorbing the nutrients from our food. Even if we're eating really
Yes.
well, sometimes we're not able to actually absorb the nutrients, so we
Mhm.
really lack that energy. So you want to get that checked out. If there's a lot of food sensitivities that
Yes.
are increasing over time, that's another thing. Anemia, again, nutritional deficiencies. We want to know why. Like, why are we anemic? Why do we have these nutritional deficiencies? And another thing that's related a lot to gut health is skin disorders, so any sort of
Yeah.
skin issues, as well as joint pain,
Mm.
and of course like the brain fog. And the our gut health and our hormones are so intricately connected as well, so a lot of the
Mm.
time imbalanced gut can imbalance hormones and vice
Mm.
versa. So that's something as women we need to be really mindful of. And then
Mm.
you ask, how can Ayurveda support IBD in conjunction with conventional medicine? And like Ayurveda can be used in conjunction with any sort of medical thing. Like I use functional medicine, I use my medical background, I use
Mm.
Chinese medicine and acupuncture and Ayurveda all together
Yes.
because it can just blend with everything. Because what Ayurveda does really well that conventional medicine doesn't do as well, and that's coming from someone who's been in the Western allopathic medicine for 20 something years now. I'm still registered in it.
Yes.
Is that it's not as spot on with the dietary advice, the lifestyle advice, can kind
Mm.
of give blanket advice in that way,
Yeah.
whereas Ayurveda is very specific for the individual person. So we
Mm.
have what we call dinacharya, and that's like our daily routine.
Really,
So
dinacharya, yes. I'm like dinacharya. It's a Sanskrit word, but
yes,
like when you say it, it's like, oh yes, dinacharya, because we grew up listening to it. But when you say it, it's like, oh, hang on,
of
Harmony
course,
is
yes,
speaking it.
yeah,
Yes, the daily
dinacharya.
rituals. Yes.
Yeah, daily rituals, especially if, we know that IBD can really be triggered by chronic stress, right?
Mm.
So our daily rituals can really support our nervous system. So we can
Mm.
implement different breathwork practices, different movement practices,
Yes.
beautiful rituals that are going to support the nervous system. And then we have nutrition, depending on your constitution. If you're someone of a Vata constitution, and you've got IBD, you really need to be eating warm, grounded foods. And
Mm-hmm.
if they're cooked, they're easier to digest. So if you've got
Mm-hmm.
digestive issues and you're eating a lot of raw foods, even though they can be really healthy and good for you, it's going to be a
Yes.
lot harder for your system to digest
The
those.
digest. Yeah. Yeah.
Yeah. And then
Mm.
we can implement some like prokinetics and some like herbs and spices to help our digestive system and that agni, which is like adding a little bit of ginger if you tolerate it, adding like cumin and fennel seeds, things like that that can really support our digestive system. So
Mm.
because what we want to do is have a really strong agni and good digestion, because if we don't, and we know that we're prone to this inflammatory disease, it can
Mm-hmm.
increase inflammation, just like stress can increase inflammation. Any
Yes.
stress on the body, like not
Mm.
digesting our food properly,
Not being
will.
able to digest it properly. Yes.
Exactly. So
Mm.
there are a lot of things that we do, and also we can support it with different herbal medicines. We can support, like I support it specifically as well through acupuncture, just to
Mm-hmm.
calm the gut-brain axis down.
Mm-hmm.
Yeah, so there's just so many different ways. There's certain topical oils that we use and create for individual constitutions as well to
Yeah.
help soothe the gut and the inflammation using topical oil. And we would use that oil to do self abhyanga, which is this self oil massage of the whole body,
Mm.
including the gut, because that
Mm.
also calms down the central nervous system as well. And so a lot of treatment is looking at nervous system regulation,
Mm.
inflammation, and diet.
Yeah. So it's very interesting, Harmony, that you're saying this, because I grew up doing all of these things. The full body massage, it's like it's not, it's like a ritual, but we did it, but like a ritual, but I never understood the benefit of it. But now you're explaining it, how beneficial it is, and I truly appreciate that. And I also wanted to ask, how can people find out they are sensitive to certain food?
You can do food sensitivity tests. So there's a few different
Mm.
ways that you can do it. Obviously, if you keep a food journal and you can document if you're
Mm.
like, sometimes you eat something and then you feel like you get headaches every now and again and you're wondering if it's related to food or if you get
Mm.
really bloated, then I would say keep a food journal for 4 to 6 weeks, documenting
Mm.
what you eat and then what any
Okay.
signs and symptoms you get.
Yeah.
But there is ways that you can test it through IgG, IgE, IgA testing, which is looking at those antibodies, and that can be done through like a special pathology test,
Mm.
which is like a skin prick, really, like it's just a skin prick.
Mm.
And also you can do hair testing as well that tests
Okay.
for sensitivities. So there
Okay.
is different functional medicine tests that you can do to look at what sensitivities you could have to food. And
Mm.
then the idea is because when you've got either IBS or IBD, the lining of your gut, the integrity of your gut lining isn't as strong. And so
Mm.
what can happen is we create what we call like leaky gut, where the
Mm.
villi in the intestines sort of start to, instead of being tightly pulled together, they
Yeah.
start to slightly separate. And then
Mm.
what can happen is some of the food particles, so to speak, can move through the
Pocket.
gut
It's like,
lining
oh yeah. I think
where it
one of my
shouldn't.
friends at Pocket.
Yeah, well, it shouldn't be in there, and then our body
Mm.
mistakes it for like something, dangerous, and then starts to attack it, and that's how that sort of
Mm.
autoimmune condition can come about with these food sensitivities.
Yes. So
Yeah.
they, you just mentioned about the IBS,
Mm.
because I was getting confused between the IBS and IBD. And can you please briefly explain that what is IBS and IBD, the difference?
Yeah, so IBS stands for irritable bowel syndrome, and it's
Yeah.
more so diagnosed through symptomology. So if you
Mm.
have chronic bloating, constipation, diarrhea, you can have a fluctuation of both. But there's no sort of underlying pathology that we actually, or the medical team actually see. They'll usually
Mm.
say, well, you've got IBS, irritable bowel syndrome, and
Mhm.
that's characterized by having these symptoms for, I don't know, like say a month or so, but usually a lot longer, and having
Mm.
these sort of daily symptoms. And it's sort of like this ongoing thing. Whereas IBD is inflammatory bowel disease, and there can be pathologies that are seen with that. And it's often a group of diseases that are clumped together, such
Mm.
as Crohn's disease, and ulcerative colitis disease, that have that inflammatory aspect that we can
Mhm.
actually see in the gut. So if you have IBS, it's not, you don't necessarily have like these like full inflammatory or autoimmune
Mhm.
response, but it could be that you're so sensitive to gas bubbles passing through the gut that
Mhm.
you bloat really easily. So it's
Mm.
IBS is more of a cluster of symptoms that's sort of like, oh well, you've got gut stuff going on, but we don't have a actual diagnosis
Specific
like
effects.
Crohn's
Yeah.
or diverticulitis or celiacs or anything like that. Then we'll say
Mm.
it's IBS.
Okay. Okay.
Yeah.
Okay. Thank you for that because it's
Welcome.
I learning to specify the different symptoms is like,
Yeah.
yeah, I'm trying to learn, and I'm sure that people would like to know that
Yeah.
too, right?
And they can
And
have similar symptoms. And the other
mm,
thing I will mention, like I said, sometimes there's not a lot of pathology you can see in IBS, but you can see disruptions in microbiome. So you can have
yes.
overgrowth. And so like SIBO, small intestine bacteria overgrowth, and also LIBO, large intestine bacteria overgrowth, is also clustered in the IBS group as well.
Yeah, cool. So yeah, so it's always helps when we understand. And
Mm,
then, people who are watching this and they might understand, oh, and even have a conversation with their GP or, their healthcare practitioner. So, they
yeah.
might look into it. So, what are the gentle Ayurvedic approaches can help women improve their gut health, energy, and overall well-being while managing IBD?
Yeah, so I'm going to start with overall, as women, we always need to support our nervous system,
Mm,
especially as we are getting more into that sort of 40s through to 50s,
Yes.
that perimenopausal transition to menopause, we are less resilient to stress due to
Mm,
hormonal changes.
yes.
And that means that our gut can also be more reactive. So,
Mm,
supporting our central nervous system is so, so important. And so,
yes.
I would go back to having a beautiful dinacharya, as we spoke about, having a daily routine that is going to start with nourishing yourself first. Even
Yeah.
if it's 5-10 minutes in the morning where you wake up, you take a few breaths, you go out and sip a tea in the sunshine, you ground yourself, feet on the ground, whatever you need to do to honor
Yes.
yourself and also finish your day that way. You can, if you've got more time, implement things like yoga, breathwork practices, Tai Chi,
Mm,
whatever works for you. Walking out in nature, like connecting with nature is such a powerful way to reset
mm-hmm.
our circadian rhythm, our hormones, and just calm the
Yeah.
system. So I would say
Yeah.
that's number one. And then number two is looking at your diet. So
Yeah.
we don't want to be snacking all the time. We want to
Yeah.
have those main meals and we want them to be cooked, warm, and nourished if we have IBD
Yes.
specifically. And then if we can work out what our constitution is, we can start adding in special herbs and spices that are also going to support our
Mm,
individual constitution. So it would be that lifestyle piece, that diet piece.
mm,
And then again, for you can add this into your dinacharya, but it would be doing something like the Abhyanga and really focusing on the gut health,
yes.
especially if you are someone who maybe more so has IBS and you have like a constipation type of IBS, to really get that gut motility going.
Mm,
It really supports that. And also the reason that we do the whole Abhyanga massage is to help support our lymphatic system. And when we move our lymphatic system, we are more able to detoxify our whole body, and that can reduce that inflammation.
yeah.
So again, we're
Yeah.
always looking at how are we going to reduce inflammation? How are we going to support our immune system? And in
Mm,
Ayurveda, we have the term ojas, and ojas
mm,
is our immunity and our vitality. And so, how are we going to support that? And it's even things of like, how are we finding more joy in our life?
mm,
How are we building strength and resilience? And
mm,
when we specifically get into this sort of age group, 40s through to 50s, are we incorporating strength work? Because that
yeah.
builds resistance and strength in the body. Are we
Yes.
moving our body? This is all
Mm,
going to help support a healthy immune system and decrease inflammation and support our mental health and nervous system. So they're the things that we always want to look at from an Ayurvedic perspective is lifestyle, nutrition and diet, sleep, how are we sleeping, healthy movement, and
mm,
connection to
yeah.
self, connection to others, connection
Mm,
to divine, depending on your belief patterns as well.
yeah. Yeah. Emma is, hi, Emma. She
Hi,
says, I
Emma.
think I have just entered the start of the menopause phase. If you have any question, Emma, please, yeah, comment down below and welcome. Thank you for being here. And if
Yeah. Hi,
anyone
Emma.
has any question, please put the comment down below. And while we're waiting for the question, Harmony, please let us know where we can find you.
Yeah, so I'm active on I mean, we're on Instagram. So
Yes.
Harmony Inspired Ayurveda. Go
Yes.
follow me there, reach out in my DMs. Happy to have a chat.
Mm,
My website, if you wanted to book consultations or acupuncture treatments or anything like that, is
mm-hmm.
harmonyinspiredhealth.com.au. But if
Yeah.
you're interested more so in studying Ayurveda or Vedic breathwork, any of those beautiful modalities, then
Mhm.
I do run an academy called the Ayurveda Alchemist Academy, and the website's ayurvedaalchemist.com.au.
Yes.
And if you want to read about your gut health, how to do all these things, how to set up a dinacharya, your hormones, all of
Daily
that, then
rituals.
you can go
Dinacharya is daily. Yeah.
my
There it
book.
is. It's beautiful book. Yes,
Yeah,
amazing. And
Ayurveda and the
it's been
Alchemy of Her.
best selling, right?
Yeah, bestseller
Yeah.
in 24 hours.
Congratulations.
Yeah, thank you.
Yes, amazing. Yeah. So is there anything else they rephrasing all our chat, would you like to leave any message at the end?
I think that what I would say is from an Ayurvedic perspective, we always talk about our gut health being the core, the center of our health. So doing things to support that is going to absolutely support your overall health, your integrity. And when we talk about increasing your Agni, it's the process, yes, to digest our food and so that we don't get armor and the toxins build up, but also to digest our emotions, to digest our thoughts, and to digest the experiences that we're constantly taking in. So we really look at health being this sort of holistic framework, and that the mind and body are intricately connected. So how can we support our whole well-being? And it can be just doing those simple little things that I mentioned earlier.
Yeah. So yes, so we will have to go back and watch all of your amazing, you know, all the gold nuggets that you have dropped in our life. So that is amazing. And if anyone has any issues with their gut, please reach out to your healthcare practitioner. And like Harmony mentioned earlier, you know, reach out to her or So we will, and I'll put all the information in our caption. Thank you so much, everyone, for being here. Thank you, Harmony, for being here. I truly appreciate your, you know, your presence, of course, and your knowledge and all the above. Okay, thank you so much. Have an amazing day, everybody. Thank you. Namaste. Bye-bye.